Hello, it's Dr. Shelly with Shelly's Nursing Review and HETV, Health Education Television. Now, we have a couple of videos coming up. The first video we're going to share with you is the video about breastfeeding basics that all nurses want to teach their patients, their wonderful families, on how to breastfeed, how to storage, what to do. So just some basics. This is a quick video because it's kind of easy. And then the next video will be the benefits of breastfeeding for the baby, the top 10 benefits of breastfeeding for the baby. You may know that we did maternal benefits of breastfeeding a week ago, so find that video. Now, I'm wearing my magical shirt. Yeah. Did you notice? Well, if you're supporting whom I'm supporting, please go find the video that says half off everything. It's a quick little one minute short, and it tells you how to win half off anything. And you have 24 days. So hurry, we want to help you. Now, back to the lecture at hand, the video, right? Breastfeeding. So this next video is just some quickie tips on what nurses should be teaching their patients. So patient education, which is power. Hello, got milk? So let's go. Let's get started because it's kind of easy. Now, I don't know if you have it, but I'm going to show you that you should. Obviously, everything I have, all my little handouts are available through PayHip. But, you know, if you want the discount, you got to text me directly, right? You know that. So let me show you the handout that goes with this video. The handout that goes with this video is your maternity handout. And as you know, last week we did the whole benefits of breastfeeding for mommy. So we did that. After this video, I'm going to be talking about the benefits of breastfeeding for baby, the 10 of them. But for right now, we're just talking about what should you be teaching your moms about certain things that have to do with breastfeeding. Just kind of quickie tips, nothing major. You will have to open up your packet. And I always utilize forms in the packet that may not say exactly what the name of the video is, but it shows you have lots of room to write stuff. Take notes. So here's a sheet in your maternity packet. You could either write on that one or on the other side of it, postpartum assessment, you could write some of these tips on breastfeeding and what to teach. You can actually write some of those on those handouts, those pages in that handout. So let's go. Let's have fun. Like I said, this is kind of a quick video. Here's some quickie breastfeeding tips to share with your families. Here we go. Remember, nurses, to teach 8 or more in 24. What does that mean? Babies should be eating, breastfeeding, 8 or more times in 24 hours. Now, if this mother has a situation where her baby can't personally nurse from her breast at that time because baby's sick, mommy's sick, whatever's going on, premature babies as well, then she's gonna actually need to pump every what? Did you do that math? 8 or more in 24. So how often will she need to pump, people? I failed math. I don't know the answer. She'll need to pump every 3 hours, even at night at first, okay? It's just what it is, all right? So that's the first one. Breastfeeding babies, teach mommy. Breastfeeding babies will have way more stools than the formula-fed baby. Yeah, these babies will have, 10 stools a day, easy. And the stools are like the color of mustard. So tell mommy and daddy, they're gonna be yellow, they're gonna be soft, they're gonna be mustard colored, and they're gonna be very seedy, okay? Because breast milk is made for humans, so it's easily digestible, and that's what this baby's gonna have. More stools to prove it's so easy to digest. No constipation, okay? That's what you get when you have to use formula. I did both. I did formula with my first because no one told me about breastfeeding. And then I breastfed my second, and it was worlds apart. The constipation with the formula feeding, it was like, ooh, drove me nuts, okay? So that's just back of your mind, keep that thought. What else do you teach, nurses? You teach all moms, whether they are formula feeding or they are breastfeeding, that it's actually kind of dangerous to give babies younger than 6 months water. They don't need it. No, I remember when I had my baby, my baby daddy, his mother, who was like, let's just say not nice. That's the best way I can put it. She was riding my ass because my daughter was born in May. We happened to be at her house in July. It was a hot day. That baby needs some water. I can't believe these young mamas of the day ain't shit. That baby needs some water. You know what Tim Walz said, you know, Kamala Harris's vice president pick? Mind your own damn business. Jesus. So anyway, that's just one of the aggravating things she did. But you got to remember my scenario, because no baby needs water. It's actually very harmful. It could give them hyponatremia because the baby's body is 80% water. They don't need any more. And so when you give the baby water, you are diluting the effects of the sodium, which is very important in the human body. Next thing to teach your families: the first feed of this brand new life needs to occur in the first 30 to 60 minutes of life. Preferably 30, obviously, but you got up to 60 for things to go really, really well. Now, if you cannot feed this precious baby that early for any reason, then mom hopefully is set up with pumping. But the reason why it matters that she nurses in the first 30 to 60 minutes of life, which is why we do, you know, a lot of things to help that kind of progress really successfully, is the fact that the baby nursing in the first half hour of life stimulates more breast milk than if she waits till later that day. And it kind of carries on day to day with more milk production because she started so immediately after delivery. I've often just, you know, threw the baby on the breast as soon as I delivered the baby, right? I'm a nurse midwife. So I used to deliver the baby and I would put the baby on the breast and say, try nursing. It's just for fun and it's to help you stimulate your milk production. And moms were like shocked that the baby went right to breast. That's a time of very high alert. Remember, that baby's very alert in that first 2 hours. Capture them, put them on the boobie, and let's go. Next is the best way to stimulate the production of milk and for things to go extremely well is skin-to-skin contact. Did you know just skin-to-skin contact without a baby even nursing on top of you? Just your skin, nothing on it, and baby's skin, nothing on him except over him to keep him or her warm. That skin-to-skin contact without even nursing will stimulate breast milk production. It's kind of cool. So, you know, I think everyone knows now that skin-to-skin contact is critical immediately after birth. In fact, even our C-section moms, I remember when my daughter had her C-section with baby Bryce, who's now old, but baby Bryce was put right on mommy while she was on the OR table. I was like, wow, so cool. The next one is rooming in. Let these two people who hung out together for 9 months hang out. Everything should be done in the room, right? Encourage mom, empower mom, advocate for mom to have that pediatrician visit in the room. Most hospitals, you don't have to tell those doctors that. They're up on the, here we go, baby-friendly initiative. I know when I worked at university hospitals, the pediatricians came right in the room and did the exam in front of the mom and taught the mom all the stuff that she needed to know, including the fact like the baby loses 10% of their weight before they leave the hospital. You might want to write that down. Yeah, babies lose 10% of their weight before they leave the hospital. Totally normal. They lose that 10% of their birth weight and then they gain it back. That's normal, you guys. Okay, here's another one. A baby who is nursing really well. It might be really difficult for mom to figure out that she's giving her baby enough because when she first looks or even pumps, she might not get hardly anything out. Number one, the baby is the most effective at getting anything out of the breast, right? Mommy can help the baby by literally taking her hand, her thumb on top of the areola, her fingers underneath the areola, and hand expressing colostrum to get it out, and then smear it all over the areola and put the baby right on. They've smelled that smell before. It's amniotic fluid, same smell as breast milk. And believe it or not, when they taste it, it tastes a lot like amniotic fluid. So moms can help their babies get everything they need, but you needn't worry. Make sure you tell mom that when that baby is born, their stomach is only the size of a marble. And then as that baby nurses every day, by about day 2, 3, 4, the stomach has grown into the size of a golf ball. These are full-term kids, of course. So 37 to 42 weekers will do fine with that little bitty bit of colostrum. Remember, it's power. That's the part that has a lot of antibodies in it. Next is 6 to 8 wet diapers a day. I think I said that, but I was off on a tangent about colostrum and getting excited about how amazing it is that all this colostrum has antibodies. And I don't know if I said it, because I better say it again, because it sounds like something that might be on a test. 6 to 8 wet diapers a day, y'all, says the baby is doing what they're supposed to do. Your baby's getting enough as long as they have 6 to 8 wet diapers a day. Critical that you know that. Breastfeeding babies need vitamin D supplements, usually about 400 international units every single day, because the breast does not have vitamin D, and not to mention most of us are deficient. I told you before, you need to get your vitamin D level checked, and if you have no insurance and you, well, vote for Kamala, but if you have no insurance, you need to understand that just going to the over-the-counter, it's like highly recommended because it's what I do. What I do, remember I always tell you what I do. What I do is I take 2,000 units of vitamin D every day. Nobody's got to tell me to do that. Nobody's got to measure my vitamin D to tell me to do that. I know that vitamin D deficiency is an epidemic. And you might be thinking, well, what does it do for you? Well, it's your immune system, honey. Yeah, if you want to prevent autoimmune diseases, you will pump up the vitamin D. Don't do too much, okay? Talk to your doctor or nurse practitioner about whatever. But I'm saying what I do to help my immune system. And also remember vitamin D for depression. So depression responds really well to vitamin D, okay? So you just need to know babies need the vitamin D as well. Here we go. After 6 months of breastfeeding, babies also need iron supplements. Now, if they are weaned to formula, they're going to need iron fortified formula until they're 1 year old. If they're still on breast milk, hallelujah, they are going to need iron supplementation after 6 months. So that was some quickies. Let me go over a few more with you. And this video is like almost done, so you're going to be okay. I know a lot of us have ADHD, so here we go. Storage of breast milk is often a favorite on test. Are you with me? I hope you are. Storage of breast milk is often a favorite on tests. So remember this. If mommy and daddy have a deep freezer, they can store breast milk in there for a whole year. If they have a regular refrigerator freezer, the freezer compartment of a refrigerator, they can store breast milk in there for 6 months. The best way to store it is flat and in bags, and never in the door of any freezer or refrigerator. In the refrigerator, as long as it's 40 degrees Fahrenheit, you can store breast milk for 4 days. Not in the refrigerator door. 4 days in the back of the fridge is optimum. Breast milk that you have just pumped can sit for 4 hours. And you might be thinking, that doesn't even sound good, because formula can't sit for 4 hours. You doggone right it can't sit for 4 hours. It's only 2 hours. Formula can only sit for 2 hours in room temp. But breast milk got white blood cells in there, honey, all ready to make sure it kills any germs in that breast milk. Isn't that cool? God made no mistakes. God made no mistakes. God made no mistakes. Woo! All right, now listen. It can only be stored in room temperature for 4 hours, provided you just pump that bad boy. Okay, so don't get it twisted. All right, you good? All right, let's look at some other things. Thawed breast milk must be used within that day. So you took it out of the freezer last night, which was optimum. You put it in the refrigerator to thaw. You better have that thing gone and out that refrigerator by tomorrow. 24 hours, okay? Never, ever, ever, never, never, ever, ever, never, ever, ever, ever microwave shit for a baby, fool. Especially breast milk. If you microwave breast milk, you're going to destroy the freaking nutrients. What was it all about after all? No microwaving anything for a baby, but especially breast milk. Okay? Now, I have to go because that video is over. I told you it was a quickie because we all like quickies. I do. Anyway, so listen, you need to stay focused. Here's the deal. You, my love, some of you are coming up to Cleveland, Ohio for your 3-day boot camp. I'm excited. You need to know before you come that I fucked up, and so you're about to get lucky. I fucked up. Yeah, I told you Friday, Saturday, Sunday. No, it's not. It's Saturday, August 31st. Sunday, September 1st. Monday, Labor Day, September 2nd. Guess what? When you come up to Cleveland, you get a packet of your choice free. Because when I fuck up, you benefit, you get lucky. Now, if you don't know anything about our 3-day boot camps that we have in Cleveland, Ohio, which there's a huge sale on, so half off. They're usually $400. You can get them for $200. 3 days in Cleveland. Yeah, we even have cheaper hotel rates now because I negotiated with the hotel to hook y'all up. Make sure you get the cheaper hotel rate for real. But if this is you and you want to come to Cleveland, Ohio to hear me live and up in your face and crazy and ghetto fabulous, and teaching you how to pass your NCLEX, because it's a 3-day NGN boot camp, right? It's all about how to pass. And it gives you so many resources, including 8 pink packets with the class. If that's something you want to do, 216-410-0936. And again, remember, Kamala gets you half off. Deuces. Love y'all.